Attorney General, senior government officials, members of the media, fellow Namibians, good afternoon. I have been mandated by His Excellency, Dr. Hage G. Geingob, to lead the 27th COVID-19 public briefing. His Excellency, the President, is on a working visit outside Windhoek. As it is happening in other countries around the world, the fight against COVID-19 pandemic in Namibia continues. In order for our nation to prevail against this threat, we have added more ammunition to our arsenal in the form of COVID-19 vaccines. It is encouraging that more and more Namibians are coming forward to get vaccinated. The Ministry of Health and Social Services has established a total of 383 COVID-19 vaccination sites in different health districts around the country. Of these, 181 are fixed, 154 are mobile, and 48 are outreach points. So far, more than 20,315 persons have already been vaccinated around the country, following the rollout of the nationwide vaccination program. This is indeed an encouraging, positive public response. We call upon more Namibians to go and get vaccinated. The vaccination program is being rolled out under the auspices of the existing expanded program on immunization, through which the ministry has implemented vaccination campaigns in the past. This approach means that we do not have to create new structures and capacities to roll out COVID-19 vaccination program. Rather, we are harnessing existing knowledge, expertise, facilities, and infrastructure already in place. In this manner, we are able to benefit from cost saving, administrative efficiency, and logistical arrangement. It has been reported that some individuals have been turned away from vaccination sites and denied vaccination because they did not have national identification documents. I wish to clarify that no eligible person should be turned away and denied vaccination. Person without a national ID can be vouched for by another person with a national identification document who knows him or her and who have received COVID-19 vaccination. Also, documents such as health passport, voters registration cards, documents from church authorities, and driver's license may serve as identification documents. In cases where none of these can be produced, a person without an identification document may simply provide their birth date, and if the birth date is unknown, the health workers will use the date of vaccination and the person's name for record purposes. Again, the nation should know that the vaccines are available for all Namibians and people residing in Namibia at no cost. We will continue to share this vital information as part of our public education and awareness raising campaigns on COVID-19 vaccination. I reiterate that our national COVID-19 response and preparedness is informed and guided by the available scientific information and data. The experts and healthcare workers who are involved in the planning of our public health measures and health interventions continue to engage and consult with their counterparts around the world to ensure that our response is effective and produces the desired results. In this context, all that we do as far as the response is concerned, we take into account the latest available data. Currently, the COVID-19 epidemiological trend in Namibia calls for greater vigilance. It calls for all of us to take personal responsibility to suppress the spread of new infections. While our country has done relatively well, it will be self-defeating if we let our guards down now. It is pleasing that we continue to improve local laboratory testing capacity for COVID-19. In addition to bringing more laboratories on board, we have also established capacity for genome sequencing at the University of Namibia. Genome sequencing conducted at UNAM indicated that variant of concern initially discovered in South Africa, B1351, is present in 60% of the samples analyzed in February. The variant of concern, B117, initially discovered in the United Kingdom, was detected in 3 of the samples analyzed. Going forward, we will utilize this scientific capacity as part of our national response and preparedness against COVID-19. Namibia will do well to learn lessons from other countries where the pandemic has overwhelmed health systems. The onus of responsibility rests upon all of us as a nation to prevent such horrific scenarios. We can do it by complying with the public health measures that have been put in place. We can do it by making the preventive and hygiene practices as part and parcel of our daily lives. This is particularly important as we approach the winter season, where people tend to be close together in close settings and where influenza illnesses tend to proliferate. The central message has been and continues to be that in all that we do, we must always aim to protect both the lives and livelihoods of our people as the rationale for our response. The impact of COVID-19 pandemic on various sectors of our economy is grave. Therefore, it is critical that we retain our national economy on the trajectory of growth. It is for this reason that we continue to review the measures put in place, cognizant of the fact that our society and our economy has been hit by the impact of the pandemic. At this occasion, and before the expiry of the public health regulations that came into force on the 1st of April 2021, and which will expire at midnight on the 30th of April 2021, I will share with the nation the amended measures to come into force at 00 hours on the 1st of May 2021 and to last until midnight on the 31st of May 2021. As I stated at this venue on the 31st of March 2021, the COVID-19 epidemiological curve has not shown a downward trajectory to the levels where we can say our country is out of the woods as far as COVID-19 infections, related illnesses and deaths are concerned. In other words, we are still far from sustainably flattening the curve. Let me reiterate again that at present, the number of new infections in our countries remain high. Infections are being reported on a daily basis from all the regions around the country. The basic reproductive ratio, or the rate at which a single infection multiplies or gives rise to other new infections, stand at 0.94 for the epidemiological week 16, or the week from 19th to 25th of April 2021. For the epidemiological week 15, that is from the 12th to the 18th of April, the basic reproductive ratio stood at 1.3. We have thus recorded a slight decrease in this figure. Ideally, the basic reproductive ratio should be less than 1. Unfortunately, the current data available indicates that COVID-19 transmission in our community is continuing across the country. It is from this vantage point that the National COVID-19 Dashboard Monitoring Team and the National Health Emergency Management Committee made recommendations for the public health measures that will come into force at midnight on Friday. Where no change is announced, the regulations remain in place and in force as earlier gazetted under Regulation 233. I would now proceed to indicate where amendments have been effected. Under Regulation number 2, application of the regulation and the duration, I have already indicated that the amended regulations shall remain in force from the 1st of May 2021 to the 31st of May 2021. Wearing of masks. Correct and mandatory wearing of masks remains part of our response. However, enforcement and compliance must be strengthened with the involvement of community leaders, traditional leaders, religious leaders, and law enforcement officers. Again, we plead for voluntary compliance. Public gathering and curfew and measures related to education. Public gathering will remain at 100 persons, both for indoors and outdoor gathering, as per the current regulations. Measures related to education also remain unchanged. The curfew starts at 22 hours until 04 hours, as is currently the case. Regulations related to education. Learners from boarding schools where active transmission of COVID-19 is taking place, they will remain in boarding facilities. Restrictions relating to sporting activity. This is a good news that currently spectators will be allowed at sports events. However, the number of spectators shall not exceed 100 persons at any sport event, and all the spectators must comply with COVID-19 protocols. Restriction relating to entry into Namibia. A person who leaves Namibia for another country with a negative COVID-19 result and returns within the validity period of such test, which is 7 days, shall not be subjected to COVID-19 tests upon returning to Namibia. Quarantine and COVID-19 testing. Namibians who return to the country without COVID-19 results, they are quarantined either in home or in government-supervised quarantine facilities. All persons seeking home quarantine must submit an application for supervised home quarantine. Home quarantine is approved when the home environment is suitable for effective quarantine. Persons whose homes are unsuitable for home quarantine will be quarantined in identified approved facility, but at our cost. The exemption for those who qualify will still apply. All quarantined persons will be tested on day 7 and released with negative result, or in the event they have positive result, they will then be placed in isolation for a number of days that have been approved for this purpose. Public transport. Public transport operators are permitted to load to full capacity. However, the enforcement of compliance with the regulation still remain with authorities and also with the owners of that public transport. Designation of COVID-19 response centers, quarantine facility, and isolation facilities. This regulation is amended simply by adding the following phrase, and I quote, at any other place, premise, establishment, or any other place other than the health facilities to cater for instances where this facility have been used, but not specifically stated in the regulations. Testing for COVID-19. The PCR test for COVID-19 remains unchanged. Negative antigen rapid diagnostic results are recognized and accepted in Namibia. Only nasopharyngeal and oropharyngeal swabs are required and not blood specimen. A person tested for COVID-19 should not travel pending his or her results. In other words, if a person is tested for the purpose of traveling, should not undertake the trip until the results are known. COVID-19 related deaths and burials. Only 2 persons are permitted to view the body of the deceased at a time for 2 minutes. They shall maintain at all times all COVID-19 preventive measures. The maximum number of people allowed at the burial of a COVID-19 death remains the same as for other public gatherings, which means 100 persons. The law enforcers shall ensure compliance with these regulations, taking into account the sensitivity towards the bereaved family. Regarding persons transferred from one hospital to another in a different town, the Ministry of Health and Social Services is responsible for transporting the body back to the hometown if the family cannot afford the services of an undertaker. The body of a person who died as a result of COVID-19 complications outside Namibia shall be allowed in Namibia if cremated. Offenses and penalties. Penalties in respect of non-compliance with regulations are prescribed in the Public and Environmental Health Act of 2015. However, adherence or compliance by the public with the regulations are strongly encouraged, but shall be strengthened by law enforcement officers. Again, I would like to emphasize the point that we again plead for voluntary compliance so that there should be no reason for enforcement of the law in the form of penalties. Fellow Namibians, we are conscious that these measures are difficult, but they are necessary. We need to have them in order to suppress the further spread of the new infections, severe illnesses, and avoidable deaths. For the sake of our country, our citizens, and all those who find themselves within our borders, we must tolerate this temporary pain for future prosperity. Everything we do must be aimed at ensuring that our health system is not overwhelmed by the pandemic. I once again call on the nation to stand together against COVID-19 until we prevail. I thank you for your attention. I will now invite any of my colleagues whether it's the Minister of Justice or the Attorney General, whoever would like to take the floor first.
Thank you very much, Honorable Minister, Attorney General. For the sake of completeness and perhaps for emphasis, I want to just raise the following issues, particularly because it's clear that the members of the public don't always have access to the full regulations and may not always know what has remained unchanged. Honorable Minister, one of the biggest things that I have certainly noticed over the past 1 month and even in previous periods is the fact that we continue to wear our masks incorrectly. And I want to emphasize that the correct wearing of mask is over your nose and under your chin. And for people who use the face shield, it is an additional requirement that members of the public also wear a mask. I think the idea really is to ensure that you continue to prevent and combat the further spread of the virus in the manner in which you're wearing your mask. The second important thing, Honourable Minister, is the fact that we need to ensure that we maintain social distancing. I know that for the longest time, people have struggled to maintain social distancing, particularly when they're wearing masks. The idea is really that you still maintain at least a minimum of 1 meter once you are interacting with people that are not from the same household as you, whether it is at your workplace and whether it is at a social gathering. We encourage members of the public to please ensure that you maintain 1 meter of social distancing. It was interesting, earlier today I saw children demonstrating what social distancing of 1 meter looks like, and we expect our adults to follow suit. Honourable Minister, the other 2 important regulations that govern interaction outside of your household is the number of people that should be gathered. I know that people often try and have at any given time for a function 300 people, and people would say we would have them in different rooms and so forth. We don't encourage that, because at any given time people are likely to converge on each other once a particular event is finished. When we say 100 people, what we mean is whether the event is indoors or the event is outdoors, we are expecting only 100 people to be at that particular place. But we must also remember that you must be able to maintain social distancing when you have 100 people. It is not only the number, it is also the size of the place that counts. Because apart from the fact that you must wear your mask consistently, it is also expected that there will be sufficient space between the 100 people or among the 100 people that are at that particular public gathering. The expectation is that each one of those people would be able to have 1 meter between themselves. So you cannot have a situation where we have 100 people in a small building. I think that is what when we say social distancing and 100 people, that's what we mean. And then just to indicate that with public gatherings, even though with retail shops and so forth, there is no longer a requirement for maintenance of a register because of the setup at that particular institution. When you organize a public gathering, the expectation is that there should be a register. And I want to just maybe remind members of the public, anything above 38 is not unacceptable. You should be refused entry into that gathering if your temperature is above 38. Then in terms of the curfew, remember the curfew is in respect of people who are essential workers are the only ones that are exempted, or if you have a medical emergency, or if you are approaching law enforcement. In other words, if you are having a problem at home and you have to go to the police, those are the circumstances under which you'd be allowed. But on any other emergency that in the view of the authorized officer is acceptable, would also allow people to be able to move after curfew. What this means in respect of business activity, and I'm raising this issue, Honourable Minister, because it has been brought to our attention that there's been some confusion about the selling of liquor and the operation of business activity. I want to clarify that as a matter of course, all businesses are allowed to operate. All manner of businesses are allowed to operate. The only thing is that these businesses must stop their operation at 22 hours. But of course, it's a practical matter. People must make a determination that how long it will take, for example, for people to get home before the curfew kicks in at 22 hours. So it's important for businesses. I have seen certainly, especially at accommodation establishments, when there are people that are coming in from outside, most businesses even stop selling alcohol at 21 hours. That gives enough time for those that are at that particular establishment, that would give them enough time to complete whatever they are drinking and eating, and it still gives them a bit of time to get home on time. So it's important for people to understand whatever uncertainty there is in the current regulation that pertains to the sale of alcohol and the curfew. I think that slight anomaly is likely to be corrected during the revision of the new regulations that are kicking on the 1st of May. Lastly, Honourable Minister, I just want to indicate that it's important for members of the public to understand that the situation in which Namibia finds itself, we should consider ourselves blessed, and we must take all measures that we can to maintain the position or even reduce the incidence of COVID-related deaths, but also the increase in the number of COVID illnesses that we have in the country. I do encourage Namibians to continue to maintain social distancing, wear your mask correctly, and in the instances where you are exempted from complying with the 100, in the instance of being in a queue or you are at a workplace, we also encourage you that you are a little bit more vigilant when you're going to be around other people that you otherwise don't know where they are coming from and where they have been. Thank you very much.
Thank you very much, Minister of Justice. Attorney General.
Thank you, Honourable Ministers, members of the media. I just want to, in addition to what the Honourable Minister of Health and the Honourable Minister of Justice have just highlighted, I want to also emphasize key areas where we are experiencing some non-compliance from members of the public, and these are very, very basic compliance issues that we need to always take into account, as we have seen that around the world, things are not looking good. Look at India, Brazil, and other countries. So there are waves. The pandemic is still with us, and as it has been stated that we have been fortunate so far, but we are still fighting the pandemic, and we are not yet out of the wood. So therefore, I think there are various aspects of the health regulations that we must take very, very seriously, because they will help us to prevent and fight the pandemic. The issues about masking and social distancing are very, very important. However, I want to touch on the issues pertaining to gatherings, especially at liquor outlets, at shebins and bars. It seems that the moment people gather and start socializing and drinking, we tend to relax in terms of, health regulations. We tend to forget that we are still exposed to this pandemic. So therefore, I want to caution and urge fellow Namibians that we must not relax at all, because we'll either endanger ourselves, expose ourselves to the pandemic, or expose others to the pandemic. Therefore, we must adhere to the health regulations, be it social distancing and masking, so that we avoid closer contact with other patrons who we are interacting with at those places. And there has been also a phenomenon that has been reported to us via the law enforcement agencies that certain bar or shebeen owners, they've been locking people in after the 10 o'clock or 22 hours so that they continue drinking. It is unfortunate that when it comes to alcohol, we tend to think that, we could basically, enjoy this freedom even beyond the hours that are allowed for, for us to move around and to conduct our businesses. We obviously feel that there has been enough latitude to allow people to be able to go out, interact, and come back. So we think 10 o'clock is still reasonable. So therefore, there is no reason why people should go beyond 10 o'clock, violate the health regulations, simply to continue those activities. We want to remind people that the law enforcement agencies are hard at work. If you are found in violations of the regulations, you shall be dealt with in terms of the law. So therefore, we just want to say that instead of exposing ourselves to some of these potential legal consequences, let's comply. Then the last issue pertains to public transport. Transportation of passengers in public transport, already we know that it is full capacity. However, health regulations are still required. You're still required to wear a mask. The operators of this transport, they are required to make sure that whoever enters the vehicle also wear a mask, and they are also required to provide their passengers with sanitizers. So therefore, in order to prevent further spread of the pandemic, when people are exposed or they are traveling together in such a close proximity, health regulations must be adhered to. So therefore, the obligation is on the operators of these vehicles to make sure that their passengers are properly masked, they wear their masks. They are also provided with the sanitizers, and also to make sure that whoever do not want to comply, then they should be refused entry. They should not be served, so that at least it's clear that it's not just a question of voluntary. This is a mandatory requirement of the law that everybody must wear a mask. So therefore, we want to caution and also urge members of the public and business owners and business operators to help the law enforcement agencies in making sure that people comply with the law, and also that all of us, support and assist the health workers, the law enforcement agencies to fight the pandemic. With those few remarks, I thank you.
Thank you very much. Yes. Yes, please. Minister.
Honourable Minister, I know that the Ministry of Health and of course the Office of the Attorney General and the Ministry of Justice has also been apprised of a matter relating to vaccinations, and I know that the Ministry and the Attorney General are investigating this issue, and that's the issue of compelling people to be vaccinated. At the moment, it's a voluntary process, and people are not forced to be vaccinated, but I think at some point we will have to clarify what the position in the law would be where people are now being compelled by, for example, businesses and or employers to be vaccinated before they return to work. I just thought I should point out that issue, that it is receiving our attention. Thank you.
Thank you very much. That is very important. Can I now invite the media to come up with some recommendations?
Yes, good afternoon, Minister. I have sent you the questions, but let's just go through them. Can you tell us the status of your efforts to get Sputnik 5? There are reports that you ordered over 60,000 doses. Can you confirm that? If it's not true, can you tell us, have you ordered any and how many? Are you also aware that Sputnik 5 is nowhere near approval by WHO? In fact, they have not even managed to get through the first stage because they haven't submitted enough data and adhered to all the inspections that WHO requires. And then also, Minister, and perhaps the ED can help you here, are you aware of 34 healthcare community workers who are also called volunteers, who have been working with the ministry's COVID-19 team, that they have not been paid since January? At first, they were under the World Health Organization's payroll, but since the beginning of this year, they were absorbed under the Health Ministry's payroll, but they have not been paid. Yet their contracts have been extended to September. When does the ministry intend to pay these 34 workers? And then can the minister also give us an update on the vaccines that was also funded by MTN, the telecommunications company? We understand that other countries that were earmarked to benefit from this have received the vaccines already. When will Namibia receive their portion of that? And the Attorney General, when are you getting vaccinated? Or you were perhaps afraid of the needle?
Like who?
And we only got 24,000 doses from the COVAX, which we are very thankful for. But when is the country getting their second consignment of it? When can we expect that? And earlier this year, you told us that we need at least 500 million to secure vaccines to cover about 60% of the population. Has this money been budgeted for? Has government paid over the leftover money to the COVAX facility? And the results of some people who have been tested by the rapid antigen COVID-19 test came out positive, whereas the same person's PCR tests came out negative. And that meant that they had to be retested with the PCR tests. Is this not a costly exercise? And then secondly, what is the ministry doing to sort of dictate whether you are just going to go with the PCR test? Because if it's giving out false positives, and some have said that they've received false negatives as well, are you going to continue with this, with the antigen tests? Thank you very much.
Thank you very much. Thank you very much for your questions. I will attempt to answer some, and the ED of the ministry is also here. He will give responses to some of the questions. We will divide the labor. Now, on the issue of the Sputnik vaccine, how many doses we have ordered and what is the status of the vaccine, of the order, that one I will leave it to the executive director. Now, I will take question number 2 about the approval of Sputnik by the World Health Organization. I need to explain a few issues. Number one, when the WHO approved a certain health commodity, the initiative is from the proponent of that commodity. In the case of the vaccine, it will mean that the country, like the Russian Federation, which produces Sputnik 5, they will have to apply or to submit the dossier to the World Health Organization, and also to invite the World Health Organization to inspect the facilities. Now, you find that some of this country, there is not really an incentive for them to do so. They do produce, they go through their national approval authorities, which are rigorous, and if they get approval, there will be not so much incentive to have other jurisdictions to approve their product, unless they have big commercial interest in the product. In the case of Sputnik 5, the major purpose for them is to protect their citizens, and secondly, to give to those who may require it. So there is not so much incentive for the Russian Federation to say that they are in such a need for their product to be approved by WHO and going through all those processes. But it does not mean that if a product is not approved by WHO, it is bad or it's unacceptable. It simply means that WHO has not gone through its processes to approve that particular product. And eventually, if they happen to go through that, they will obviously come out, the result will obviously come out positive, as it has been shown to have beneficial effect and is also in great demand in many countries. So that is the response to the approval by WHO. You mentioned about 34 healthcare community workers who have been working for the ministry with COVID team who have not been paid. Well, one would like to get specific details, because this is something dealing with certain individuals, and the circumstances, how they started, under which arrangement they started, and what are the impediment for whatever was agreed upon to be made. But I will also yield this one to the executive director. It deals with human resource issues. On the donation by MTN, whether Namibia has received, let me just explain this issue. It seems there is a little bit of misunderstanding. What the MTN did was to make money available to the African Union, for the African Union to buy the vaccines and to distribute to those who are earmarked for this donation. I can only say that Namibia has not received any donation from the African Union. And we must also remember that the African Union has indicated that they have difficulties in acquiring vaccines, just like many other countries, many other agencies, because the supply is not sufficient to keep up with the demand. Many countries are attempting to keep as many vaccines as possible for their own citizens. And you might have known now the situation in India. India is a big producer of the vaccines, the AstraZeneca Covishield, but you have learned the situation in India now is dire, and therefore they the Indian government is trying to protect, to make sure that their citizens are protected. And therefore, basically the supply of vaccines to either the African Union or COVID facilities is completely limited because of factors beyond their control. And as such, they are not in a position to deliver to the beneficiary as initially intended. The next question is directed to the Attorney General, but he may pose the same question back to you. Then you can have a dialogue. We only got 24 doses from the COVAX facility. When is the country getting the second consignment? Yeah, I have explained the difficulties in acquiring the vaccines already. So that is the situation. And the latest we had today is that the commitment for Namibia to get the second consignment in May still stand. But they have again expressed the difficulties in getting the vaccines due to some specific situations like what is happening now in India. Earlier in the year, you told us that the government will need at least, the budget. I believe you have been following the budget in the National Assembly. It is still there. The Minister of Finance, in his budget motivation, has indicated the amount of money that is earmarked for the purchasing of the vaccines, and this money is still with the Ministry of Finance, because the Ministry of Finance is the paymaster. It's going to be easier for them to do the payment, and the money is still with the Ministry of Finance. It will not be transferred to the Ministry of Health by mutual arrangement, because it is better that they just pay directly rather than the money to be transferred to the Ministry of Health and then the Ministry of Health again to transfer it back to the Ministry of Finance for the Ministry of Finance to pay. So that will not be a good arrangement. So yes, the money is in the budget, and it is with it is budgeted for this financial year. Okay. The discordant result between PCR test and rapid antigen test. This is nothing strange. Number one, you see the quality of the result mostly depends on how the specimen was conducted. We have done the validation of the antigen rapid test, and we have found the acceptable level that the rapid antigen test can also be relied upon during the validation process which was carried out by the ministry. And therefore, the question of, cross-checking is nothing new, it's done all the time. But it does not mean that if there is a non-congruence between the two tests, it doesn't mean that any one of them is not good. Those are things which you can expect. It depends on the specificity and the sensitivity of both the test and also the specimen against the test. There is nothing strange about it. But we still accept if somebody comes with a negative rapid diagnosis test, it is accepted in Namibia. So those are the questions which I elect to respond to. The rest I ask the executive director to throw light upon. And of course, you can then dialogue between yourself and the AG.
Yeah, thank you very much, Honorable Minister. I recognize the presence of the other ministers and the AG and members of the media, of course. The one question relates to our procurement of vaccines with specific reference to the Sputnik 5. We are indeed looking into procuring the Sputnik 5. We have already engaged with the Russian authorities on this. They have indicated the channels through which the vaccines can be procured, and that process is ongoing. I don't know whether it will be prudent to commercially or to comment on a commercial transaction in terms of quantities and so forth. I think safe is to say that we are engaging and that process is ongoing. We want to have it concluded as quickly as possible. On the question of the 34 community health workers or whatever that number may be, it will be appreciated that as a matter of policy, no institution would want to comment on issues of a personnel nature in a media or a public platform, whether there is a dispute of one nature or the other. Suffice it to say that the ministry has indeed extended contracts for persons who were employed to serve as volunteers or in other capacities as part of the COVID-19 response and preparedness. And these issues, as we say, are being handled with each and every individual employee. This is not a class action type of arrangement. The minister has already responded to the other questions that were put. I believe those are the two that I had to respond to. I thank you, Minister.
Thank you very much. Do you want to respond, or you will talk outside?
Thank you. Well, it's a very important question, since finally, Namibians, we are becoming more and more convinced that it's the right thing to do. I just want to indicate that I'm on standby for tomorrow. You can join me for tomorrow so that we can go and get our vaccination. Thank you.
Thank you very much. There is that open invitation to you. Yes, please, next.
Thank you. Good afternoon. My name is Calvin. I hope you can hear me clearly, Honorable. From Eagle FM.
Oh, Eagle FM.
The situation in India is receiving international attention. We have seen, I was just scratching my head as to whether it's Malawi or Kenya that is barred travelers coming from India to their country. Are we thinking of any such action of putting on hold any kind of travel from the direction of India? And what would you advise possibly Namibians would be thinking of going to India right now, looking at the situation that is playing out there? And I wanted to, you've already answered my question on, because the Serum Institute of India has also been lately blamed of, delaying when it comes to the provision of jabs to African countries as a result of their own situation. But yeah, that question has been answered. Thank you so much for that. In terms of traveling to India, whether to or those that are coming to India, your advisory on that?
Thank you very much. I'm not quite sure whether I got clear your first question, but the second question I heard you are talking about the Serum Institution and the difficulty in supplying the vaccines. Yes. Let me start with the last one, which I think I have some clarity. The Serum Institute of India, which is situated in Pune, it's a very, very big institute. It almost supplies about 60% of the world vaccines. It's quite big. They are the producer of Covishield. They have at the beginning they donated 30,000 doses to Namibia of Covishield, which we are actually using already, which we are using now. But then, as I mentioned, the situation in India changed drastically. And it alleged that this was a result of some religious activities which were going on, where many people were coming together for religious activities, and then the situation got out of hand. Now, instead of now the Serum Institute giving out to other countries, the government of India assessed the situation and then took a decision that they have to cater for the Indian population because the situation, as you have seen, is dire. The health facilities, they are overwhelmed. There are no more beds for patients. Patients are being treated at homes, and they have run out of oxygen. They have run out of bed space, and now they are calling for external assistance. Some countries have already responded, especially with regard to the supply of oxygen tanks. And now the focus of the Indian government is that the available vaccines should be used in the country to arrest the situation. And therefore, the supply to outside of India has been curtailed. So that is basically the situation what you have in India. I'm not so sure whether I have covered what you wanted to say, but I was able to cover properly the question from Shelley.
That's right.
Because she sent me the question in writing, and I could read from there.
Sorry,
because
yeah.
the acoustic is not good.
That's right. I don't know if the Honorable Minister of Justice can assist. The question is in terms of travel.
Okay.
We have seen some African countries, Belgium, I'm scratching my head as to whether it's Kenya or Malawi, that has barred travel from India. We do have Indian nationals here in Namibia. We do have Namibians that go to do business in India. In terms of travel, what's your advice?
Whether people can travel.
So can people travel to India? Can Indians come to Namibia during this crisis?
Okay. Yeah, okay. Thank you very much. Now I got what you are saying. Each country has got its own policy during this particular time of how to allow people to come in or whether to allow people to go out. Now, the situation in India currently is dire. Even if they may not have closed their border, anybody who goes into a situation like that, you have to ask yourself, what is the benefit against the risk? Now, it is on that basis you can come to a proper decision whether to go or to postpone. But as Namibians, we do not, our borders are open. We do not target any specific country or nationality not to come into Namibia. But we have general requirements for anybody who comes to Namibia. Whether you are coming from low-risk country or high-risk countries, we demand that you present a PCR negative test at the point of entry. Thank you. Next, please.
Good afternoon, Honorable Ministers. Good afternoon, colleagues. My name is Samuel. I am from Informanti. Honorable, I have a few questions here. Some are
from
Informanti.
Oh, Informanti, okay.
That's right. I've got a few questions here. Some were sent to me by some people. The first one is, did the NIP or any other laboratories perhaps isolate any sample of the SARS or CoV-2? And if so, did you perhaps see that under microscope, Minister? Question number 2. Are there now different variations of the virus in different parts of the world? For example, maybe Brazil, South Africa, Angola. And if so, perhaps, just to seek more clarity, if we are still dealing with a pandemic or a regional epidemic. Number 3, if there are different variations of the virus, which one of the variants is Namibia dealing with at this time and point? Is it still the virus, the original virus that we knew, or is it perhaps the South African one or the Angolan one? The last one, why is that Namibia is the only country in Africa that does not allow ivermectin to be used to help people that are infected with SARS-CoV-2? I mean, all other countries, or many countries in Africa actually use, ivermectin to help people that are suffer with human parasites, as well as now against COVID-19. Thank you.
Sorry, can I have your question? Can you send me the question? I could...
Barely hear.
The acoustic is very bad. I could hardly...
You could hardly hear me.
Yeah.
SMS.
Can you just send the questions? Then I can read them.
Okay, I will send them.
So that I can respond to them.
Awesome.
Now, there is one which I think I got it. You ask the type of variants which we are dealing with. Yeah. In my statement, when I was mentioning about the genome sequencing, I have stated that we have built that capacity of analyzing what type of variants are circulating in Namibia. I mentioned that we had the original ones, which have been in Namibia since the beginning of the pandemic. We have also isolated the variant which was identified in South Africa, and also 3 cases of the variants which is found in the UK. So those are the 3 ones which I can mention to you what we have in Namibia. The rest of the question, I was not able to get them. If you can just send them to me. Did you send them? Okay. Yeah, the first one, whether NIP did isolate a sample of Yeah, this is what I explained. We did not do this at NIP, but we did it at the UNAM laboratory. So that's the one we assigned to do the genome sequencing for us. And the other laboratory, they continue with their normal testing for positivity and negativity. But this is done at the UNAM laboratory. Yes, the second question, whether I have answered that the variants we have are those type 3. The fourth question, the question related to ivermectin. Ivermectin, it is actually antiparasitic drug, which is used in animal. Actually, that's its original use. In South Africa, they have tried it, and I think there was a court case which said that it could be allowed, or one of the authority. I don't remember exactly. But in Namibia, that question has not really risen for anybody demanding to use ivermectin on human beings. So there was no demand for it, and nobody has asked to use it. And if they do so, they will have to go to the Namibia Medical Regulatory Authority for it to be registered for the purpose to be used in human beings against COVID-19. Yeah. The other, the different variation. Yeah, the different variation is the one I have explained already, what are circulating in Namibia, the three of them. So I think I have covered all the questions. Thank you very much. Anybody else? Yeah, is it, make a follow-up?
Yes, question
Number two, are there now different variation of the virus in different parts of the world? Yes, Brazil has got a different one. UK has got a different one. The UK, I said we have found 3 cases here in Namibia, which have the same variant as the one which found in the UK, but not the one from Brazil. We didn't get that one from Brazil. Yeah. I see, Sheligan, you sent another question. Can you say it again, please?
Yes, Doctor. We have the CDC in the US that said that fully vaccinated people do not have to wear masks in most cases. Now, they mentioned going to the movies, attending church, small gatherings inside, when they exercise and eating in restaurants and bars, inside and outside. What are your thoughts on this recommendation? But they specifically said it's for people who are fully vaccinated, so gotten their first and second shot, or if it's Johnson & Johnson, their one shot.
Yeah. Let me emphasize the fact that COVID-19 is a new disease. It has been with us for a very, very short period of time. So we know what works. We are not sure what may not work. Now, the vaccine, once you get the vaccine, it will take time for the body to build immunity against the virus. Now, how long that immunity will be fully developed and how long they last, it's still a short period for people to make a definite conclusion. To be on the safe side, even if you're vaccinated, continue to wear your mask until we are 100% sure to advise that now the immunity will last for 6 months, then you need to go for a booster, or they will last for 12 months, then you can go for a booster, or they last for lifelong, then you don't need anything. You may not need to wear a mask, you may not need to distance because you are protected, although you are within the population which is still susceptible, and among them might be those who are asymptomatic, but they can still transmit the infection. It is risky already now to conclude that because you have been vaccinated, drop your mask or drop everything else. It's risky because nobody is 100% sure. because of the short time in which you have been with the disease. Thank you. Anybody else? Any concluding remarks from the panelists?
Thank you very much. I think just to reiterate the importance of us working together and that it is a collective responsibility. Each one of us, those of us who are in leadership positions in communities and also at the national level, we have a collective responsibility to ensure that we continue to combat and ensure the prevention of the further spread of the virus in Namibia. Thank you.
Thank you very much. AJ?
No, thank you. Just to emphasize really the fact that you still have a long way to go. When we thought things were getting better, we see waves around the world. So therefore, I think this is just a warning to Namibia that we should not relax, should continue to be vigilant and make sure that we take responsibility for our own lives and for the lives of our fellow Namibians. Thank you.
Thank you very much. I would like to thank the ministers, senior officials, the media who came to join us here to share this information with the broader Namibian public. We are only guided by one thing: to prevent infection and to save the lives of the Namibians. For this, we require the cooperation of everybody. Our first appeal is for voluntary compliance. I must also inform the public that currently the penalties related to the non-compliance with the measures under the Public and Environmental Health Act have already been finalized. You may remember that during the state of emergency, there were specific penalty to say if you are found without a mask, 2,000 on the spot, etc. And when we brought the Public and Environmental Health Act into operation, there were no specific penalty for specific offenses. That is now going to come. The document has been finalized already. It's now going to come. And please, we would like everybody to avoid to become victim of such a situation where a person will be subject to penalties. This is not the situation we want, because we must be conscious that this is all in our own interest, in the interest of our families, and the interest of the broader Namibian nation. So let us work together. I thank you very much.